Good afternoon everyone, myself Dr. Rajesh Khanna, Consultant Pediatrician, KIMS, Cuddles, Kondapur branch. Health investigations in children, the least addressed topic because many of us are skeptical in poking the child, pricking the child, and child's fear and anxiety looking at the needle itself. So we don't end in getting investigations done for the children, and we don't want also. We instead request pediatrician to just offer or prescribe whatever medicines are needed. And even when the child is sick also, we usually tend to avoid investigations or tend to avoid the pediatrician who writes the investigation. So we all want medical management without investigations. But please note that at least like once on a time, when it is really needed, when it is emphasized by the pediatrician, you should definitely consider, because screening is a modality where you pick up certain children who are having serious lethal underlying problems, based on which we can properly design the course and treatment of the underlying illnesses. So starting from newborn age, we have set of investigations to rule out major disorders. For example, newborn screening. Newborn screening is a modality of blood test, a heel prick. We take 3 blood drops on a filter paper. You check in various genetic conditions, disorders, metabolic conditions, so by which you can actually come to conclusion whether the child is having any lethal issue which impairs their future developments. So congenital hypothyroidism, TSH, that is very mandatory amidst all newborn screening disorders which is screened. Thyroid holds the primary importance. 1 in 300 children you test, you get hypothyroidism, and it has to be definitely be treated at an early age if it is found, if it is detected, hypothyroidism is detected. And similarly, as a child is growing towards 1 month, you always focus on their eye checkup compulsory, because pediatrician can have their growth and development assessments, but eye vision development and retina's status, that is difficult to assess. So I advise sincerely every parent should definitely go for one basic eye checkup at least by 1 month of age, starting from 1 month of age, and subsequently once in 6 months, or at least yearly once eye checkup has to be mandatorily done. Especially for preterm babies, their ROP screening, especially after 21 days of life, it is mandatory to check it, because if there is any like any retinal abnormalities, you have beautiful design techniques, modalities of treatment to arrest at that stage and save the vision of the child. And moving on, the other investigation is hearing screening. So preliminary hearing screening for all newborn babies, it is definitely important, because if the baby doesn't hear well, they don't develop speech also, and their brain development is hampered. So audiological testing is very important. So we call otoacoustic emissions when baby is born, and later at 3 months BERA investigation, which is confirmatory test that has to be done for the infant compulsory. So apart from eye checkup and hearing checkup and newborn screening, we have ultrasound investigations to screen the inner anomalies. See, every pregnant woman undergoes TIFA, that is fetal anomalies screening by ultrasound. So after baby is delivered, if you screen by means of ultrasound, doing ultrasound abdomen, ultrasound of the brain, that is neurosonogram, and ultrasound of the heart, that is called 2D echo, if any minor problem is also there, you will be able to catch at that level. So any congenital anomalies, any inborn errors, you can detect at an early age itself. So that is suggested that you undergo those tests at least after 1 month of age. Subsequently, at 1 year of age onwards, yearly once, apart from eye checkup and dental checkup, every child is better to have one complete urine examination to look that if there is some urinary protein loss, which can also manifest in poor weight gain issues in the child, and one complete blood picture, because these days leukemias are also increasing due to various environmental influences, due to food adulterations, excess cell phone usages. So all these problems can trigger leukemias also in the children. So if you do one complete blood picture, then you will detect it at an early stage and treat it at an early stage. They are reversible, and You can in fact have a good prognosis, good future if you detect at an early stage. If you delay it or if it goes unnoticed, metastasis can happen. It can spread to the entire body, cancer cells, and can kill the person. So CBP, one complete blood picture, gives lot of information that is important. Then coming to other health investigations, that is liver function test and TSH subsequently at least once in 3 years, because even at newborn age, when child doesn't have congenital hypothyroidism, subsequently the child may develop. We got so many children who were diagnosed hypothyroidism at a later age, and especially diabetes also. And even more important, when parents are having, there is strong family history of diabetes, because children, they don't manifest and they don't present with any symptoms until and unless you do investigations. You will not detect diabetes. Most of the children, they land in emergencies with diabetic ketoacidosis, where it is life threatening situation, very highly problematic in reversing the situation. So you have to once in a while, apart from complete blood picture, go with TSH and random blood sugars, and also LFT and renal function test as well. And when the child is sick, compulsory, when you do for fever panels, at least 2 days after fever is not subsiding, you are going to actually diagnose the disease properly, if it is viral or bacterial, and then you can treat accordingly. If it is viral, usually antibiotics are not required, and you can save the antibiotics for future use. So compulsory follow pediatrician's advice and don't hesitate for investigations. Thank you all for giving me this opportunity.